Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today, set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody, and welcome to another great Sunday. Hi, Doc.
Hello, how are you?
Well, you're really wide awake today. You took your medication and everything's good? Okay, good. And we have a surprise guest here. Well, she's not really a guest. She's Linda, who makes sure that everything we do is right. We've got Nutter in the booth taking all the calls.
Dr. Ihart.
Dr. Ihart. And we got Freddy S. from AMP2. And we have an announcement to make, Freddy. You can now get Dr. Pannozzo on his app. Tell us how you do that.
You go to the App Store on your Apple device, any device that you have. You put in Pannozzo, Pannozzo
You got it.
.tv, and you download it. And you'll be able to see all the shows that he's done. Books that he sells. It even has a GPS to get to his office.
Right.
So the man is completely
in the new world. I mean, no doctors do that. I mean, this guy. So now there's no excuse for you not to be able to find this man. He's right. He can never be in the game Clue because you'll never find him.
That's right. He's in the game.
Yep.
And he's also in Boston.
Hey, congrats! Thank you so much, Boston, for letting us. And who's sponsoring us in Boston, my friend? Are we allowed to say it on the air?
I don't know if we're allowed to say.
Okay, we might not be. Okay, so
I didn't ask that question.
Okay, we didn't ask that.
But it's a biggie.
It's a biggie. You know,
it's advertising. You should be able to say it.
Well, it depends. The contract was just signed, and we rushed the shows in there
because it's a very prestigious outfit.
It is.
Yes,
and again, I will get confirmation by next Sunday. We will be able to do that. But it's good stuff. Doc is he's expanding the globe.
Well, you know what, Doc, people are starting to notice you more and more. And the only way I could judge how people are starting to notice you more and more is all those commercials are coming out bigger and bigger and bigger. They want to prove that you're not right. And you know what I say to people? All of you that went to school, I know most of you went to high school and a lot of you went to college. Here are two words I want you to look up into the dictionary: relief, and cure. Okay? Anyone can relieve pain. Aspirin can relieve pain, but no one could cure them like you do. Now that we're in Boston, Doc, I want to give out some information. Dr. Pannozzo is a graduate of Ohio State University, very prestigious medical school. He interned, in Pennsylvania, Pittsburgh, right?
Philadelphia.
Pittsburgh, Pennsylvania.
Every week he does.
I do the same thing to you. I don't know, Philadelphia.
Write that down.
Okay, Philadelphia. Doc, yes, Philadelphia. Okay. And he has actually dissected the brain to find out how he could guarantee cure of migraines.
Migraine. Absolutely right.
Okay,
yeah.
Now I want you to explain this. Remember, we now Boston is one of our who's watching your show, so please explain how you do that. How you cure a migraine.
Oh, how to cure migraine.
Yeah.
Well,
I'm not talking too fast, Doc, because I'll talk a little slower.
I can't follow him. He's...
Nobody can.
He has 2 cups of coffee, Doc.
He's very rapid.
Yes, I am.
Anyway, the headache, migraine, and vertigo, and ringing in the ears all comes from the same place, and it's at the COC1. That means the first vertebra below the skull. There's a ligament there. That's where it's from. Has nothing to do with hearing. Your hearing is mostly normal all the time. You hear this. And one guy told me he was chug, 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 like that.
Like a train.
Like a train. And I said,
He must have been playing with his Lionel.
So we fix all that. We have a virtually 100% cure rate right now. it takes a film. We have to see a film. We have to see the area, and we actually dissected 3 cadavers with that to see what the problem was in there, see how safe it is, and it is very safe. There's nothing there but this joint. And it was done at the medical school. We had a professor of anatomy spend an hour and a half with me, and we went from place to place, and very nice. And it wasn't Nova University, it was
When University?
south of that.
South of Nova, Florida Atlantic.
Florida Atlantic,
Okay.
that's where it was, yeah.
Another prestigious school down
yeah,
here.
their medical school, and there was nobody there but the professor and me, and we dissected all these things. So now we do it, and I give all the credit to that professor there. He did a nice job for me, for everybody, for all the people.
What a lot of people don't know is you are a medical doctor,
Oh yeah,
and you also are a musculoskeletal specialist.
musculoskeletal specialist. That means if you have a pain, we know how to treat it.
Guaranteed. I mean, I just want, again, if I'm repeating myself, it's just because we have a new group. Let me finish, Doc. We have a new group of people listening. I am the host.
Well, but you're right. It's a whole new world.
It's a whole world out there.
It's like starting over again.
Yeah, exactly. You got to let other people know what it is that you do, because guess what? You're in one of the top 10 markets in the country.
Yeah, and they
Because of you.
Well, the
also.
funny thing is that people don't understand, because you're a new concept to certain regions. And I'm having conversations every day now with the medical community, because they can't figure you out. They're trying to find something to say isn't true, and now they're
very
reading that it is
interesting.
true.
What it is musculoskeletal specialty is based on the anatomy and the physics of weight bearing. And it's my ideas. And you have to know the anatomy, and you have to know how the anatomy is being used before you could treat a pain. So if you just do therapy, you're lost. If you do chiropractic, you're lost. If you do anything else around there, orthopedic surgery, you lose there, because they do surgery, not treatment. So this is a non-surgical specialty, and it really works. And we have a reality show coming out,
Yes, we do.
which films the patients as they occur in the office.
I don't think we should
And you're
call it a
gonna be
reality show. It's a
you're
real
gonna be-
show. It's a real show, not a reality show.
A
Because there's no-
documentary.
It's a
I
real,
think, yeah, a documentary. Yeah.
yeah, it's a real show. I mean, these are real people. This is not scripted. Whatever you see in there is actually the way it happened. There's no editing, no scripting, nothing. That's
And you
just
could,
the way it is.
and you could go to Dr. Pannozzo's app and see,
Now, why
see
can
this.
we do that? Because it's true.
Yeah.
So you get the results, you see it right in front of your eyes, and it is true.
So if you're expecting to see a scripted show, it's not a scripted show. So a lot of things might not be like a real, but it's real, and that's the key to it. It's real.
And there's no models there. There's nobody that
Well,
we
you can see that the
recruited
people
to-
there are definitely
with
not
the
that good
script.
looking.
These are actual patients. I mean, with all their warts and everything else to them. I mean, that's what it is. But what you look at is behind all that, and you look at the result.
Well, I think one of the main things is why. Again, I'm not saying anything bad about any profession. I think surgeons are great what they do. Chiropractic can't get to the pain, and what I've learned in the 3 years, Freddie and Doc and Linda, is that in order to cure pain, you got to get to the source of the pain. Where did that pain occur? How did that pain occur? And then you could actually show on the C-arm what's causing that pain. And I know Freddie has taken numerous X-rays, because I downloaded all the stuff that you did on the
Oh,
app.
you seen the machine at work.
Yeah, and you're actually seeing a real live X-ray of what people have done, what this man has done. I know it's so unbelievable, but you know what? I tried it. I'm a patient. Freddie's a patient. I have my best friends who I've known for years are patients. I have family that are patients, and it works.
Well, the bottom line is what the doc does. People just have to realize he's in a special category.
Oh, there's no other person. that does what he
He's
does.
like Phelps in the pool.
That's right. You should get gold medals.
You get the gold medal, because a lot of people can say that they can do this. They can't, doc. And it's just the bottom line. They talk a great game, but they can't do it.
They can relieve the pain, but I don't want to have the
They
relief.
don't get the concepts.
No, right.
Now, remember, I wrote the book on this. So,
Exactly. You're the only one that does it, and your son followed in your footsteps.
Well, I'll give you a good example, a real simple example. A lady calls me up, and she has this toe pain.
Toe pain.
And it was already operated once for the toe pain. And she said, I've had this 3 years. Can you take care of it? I said, absolutely. Come right in, which I did. It took one little shot, and that was it.
How do you operate on a
Gone.
toe, though? That's like, doesn't
Well,
Small
there's,
instruments.
we don't have general
very small instruments, right?
we have general principles here. You never operate on the hand or the foot because you need mobility. That's how you bear weight. You know, when you step on your foot, the whole thing goes like that and takes up the weight, the stress, because the ligaments, the weight is spread spread along all these ligaments that hold these bones together, and there's a lot of them. And that's why there's no diabetic pain. So you hear that. And
Diabetic retinopathy.
I want people to stop going and buying Lyrica. It is not for this purpose. Foot pain is local foot pain. Diabetes is a dying back. You feel less and less, not more and more.
So I'm going to ask you a
I
question.
mean, you see people on their advertising holding their foot, it's so painful. That's baloney. That doesn't happen.
Because that's what I've always wondered. How does that drug know where to go to cure the pain?
It goes to the brain and cures the brain, not the
the
problem. That's what's wrong with that drug.
Yeah.
Aspirin would cure that pain,
Mm-hmm.
a local pain, because it's anti-inflammatory, but it's the only one. The rest, ibuprofen doesn't do as good a job.
Well, I've asked doctors about aspirin because I have Crohn's disease, and they said you'll get better results of the aspirin, and you'll do more harm with the other stuff.
Yeah.
Especially if you have to take. And if you look at aspirin, there's no disclaimer on aspirins, but if you look at Tylenol, there's other, do not exceed more than so and so. That's why they had to change the whole formula. Do not exceed a certain amount because it could cause liver damage. But
Because liver and kidney damage.
What you do, which is so remarkable, and this is what totally blew my mind. The lady that does our advertising was a patient, Dr. Pannozzo, because one of the things that Dr. Pannozzo says, you cannot endorse his product unless you personally have a problem, and he wants you to see what it's done. We had a lady, it was Leah, I can mention her name, who did she come with a boot that day? I don't remember. Did she?
No, she was going to
She
go
was going to a
and
podiatrist
get
to get a boot on.
for
an ankle pain. And he said, I watched him. He said, just walk. I mean, I could watch Leah walk up and down all day long, right, Nutter?
Yeah.
Okay. And she walked up and she walked down, and she doesn't understand why she said she had pain. He said, it's not in your ankle, it's in your back. And I sat there and I said to myself, what is he talking about?
Here we go.
I said, what is he talking? He gave her a shot. She walked back and forth, straighter, and she says, Doc, I don't have any pain.
And she's never been back.
She
no,
just calls him on the phone to see how
I'm
he's
saying-
doing.
I'm
Yeah.
saying for the
Actually,
pain.
she's
And
never
that
been
was
back,
3 years ago.
Yeah.
Now, chances are, again, I don't say anything bad about any doctors. That's their profession. I'm not a doctor. But she would have probably been operated.
Eventually, she would have.
Yeah.
And we had another lady that you know.
Oh, yes.
Yeah, with ankle pain, and she said she didn't have any back pain. I couldn't find anything wrong with the ankle, and my fingers will pick it up
Yeah.
if there is anything. And so we finally got to her back, and she hasn't been back since.
No,
So
she told me, because I saw her at the
It was
gym one day
referred.
stretching.
Yeah.
I said, what are you doing? She said, oh, I've been everywhere. I said, what's the matter? I don't even know her name. I said, what happened? He said, I told her to see him. She went that next day, and you know what she said to me? She said, my father said to me, I don't believe this. She came back and she said to her father, Dad, he couldn't find it, but he's going to research it. And she said, how much does he charge? She said, nothing. He said he's not going, it's baffling him. He said, I'm not going to charge you anything until I fix that. Now, I don't care if someone could tell me, a doctor, anywhere in the world, that says, I'm not going to charge you until I fix it. Do you know any doctor that would do that?
Absolutely not.
I mean,
it's just a good incentive.
I'm
More
absolutely.
doctors should
in
think
Jewish,
that
we
way.
call that a mensch. That here's a guy, here's a guy,
A mensch.
a mensch. No, I'll explain to you what it means later. You made fun of my shoes when I get done with you before the show's over. Now, Doc, I have to ask questions because I got a ton of them. These are new, and I want
Okay.
Boston to understand.
Now,
Go
know, we have Jonathan that does the show during the week with us, the football player.
Yes. Tell him what he said.
Well, I asked Jonathan to get in touch with the Jets brass. I mean, the Jets are on my team.
Yeah.
And unfortunately, I write to them, they don't answer. So they had a running back from the Chicago Bears that they signed. His name is Matt Forte, and
Oh,
apparently
yeah, Matt Forte.
he was running and he has damage to his thigh. What is that? When they say that you tear your
Groin?
no, the thigh. What's the injury at the back of the thigh?
I don't know.
Hamstring.
Hamstring.
Oh, hamstring.
He has a bad hamstring.
Yeah, they call it a hamstring tear, which is, probably not.
He's been out now 5 weeks
Oh,
with a hamstring tear. He didn't play, right?
well,
So
that's
there
a
was an
shame.
article that they wrote that they're concerned now. Now it's become a concern because they got 3 more NFL preseason games and then they start,
But
right?
you know what Jonathan said? They're allowed to do anything they want on
Yeah.
their own, which I never knew that, as long as it's not on the list.
The
Right.
problem is that the trainers and their surgeons will poo-poo anything but accept
They don't
what
have to
they
go
do.
now.
But the players ought to take care of themselves. What
They
do we
do.
always say about the 2 things you have to handle yourself?
Your money and your
money
body and your health.
health.
Yeah.
You got to know what you're doing with both of them.
But I told Jonathan to deliver a message. I said they're looking in the wrong place.
Yeah.
That's what the problem
Well,
is.
we know Jonathan's real. You know why, Doc? He called up the guy from the Seattle Seahawks, who was
Yeah.
on the phone with us.
Yeah.
Oh, no
Yeah,
kidding.
he was on the phone with us.
And he had the ring from winning the Super Bowl. Not this one, the last one.
2 years ago.
So he said we're going to get a couple of football players on that are actually playing, and talk about their injuries now through Jonathan.
Listen, we should have. They should come in if they're thinking of retiring because of their backache. Don't.
No, we want the new
We
guys
we
that have to
fix
make the
those.
team.
Yeah. Well,
Those are the guys that are important more than anybody.
Well, I wouldn't mind seeing Forte and getting that hamstring looked at because he had
Oh, we'd fix that in a minute.
he had a hip injury 3 years ago, Doc.
Yeah.
I'm telling you, they're looking in the wrong place. That's no hamstring last 6 weeks. This is ridiculous.
No groin injury. You should take a player off the. I mean, I'm a nobody, and my groin was fixed in
Your
2
groin
shots.
is a nobody.
Well, the groin is somebody. I
No, your
mean,
groin's a nobody.
well, I could bet you if I went to an orthopedic guy,
Yeah.
I would have been in for surgery. What kind of surgery do you do on the groin? I don't
They
understand.
remove your testicles.
Oh no, it touches my boys.
Well,
When he gave me that needle, I said, "Doc, not too close to the boys."
we'd. I don't know what they would do.
Yeah, I don't even know how you operate in the groin.
See, you should not operate or explore until you know what you're doing. Exploratory surgery is really dumb. Don't do that. You have to know what you're doing before you do that. For instance, my standard is if you don't have a pain while you're in that office, then you don't have it. I don't care about yesterday. I don't care about tomorrow. It's got to be right now. And if you don't have it, I'll tell you to go get it. Go outside, run around, walk in the hall, get that pain, and otherwise we don't know what we're treating.
A patient came in when I was there and said, "I need a shot in my back." He said, "I don't see anything." I said, "Yeah, but I need a shot." I said, "I don't see anything. Where do you want to give me?" I said, I can't give you a shot. I don't see any that you have any pain."
We don't
He
know
made
what
the person
goes.
stretch. He said, "You have any pain?" He says, "No." He said, "I can't give you anything because you have no pain."
Yeah, that's true.
Yeah, I know
That's
it's true.
happened more than once. That has happened a few times.
Well, that's my standard. So
If you don't need, why should he give you a needle if you're in charge of it? If you don't need it, he's not a placebo doctor. I'll explain to you what placebo means afterwards. Okay?
I know what
The
a
other thing
placebo
is,
is.
once we treat people, they want to know if they have to come back. I said, don't come back. We're not looking for you to come back.
I watched a lady that couldn't even bend a quarter of an inch. A little lady couldn't even bend. Oh, I got so much. And he gave her a shot. And she said, "Oh, I still feel a little pain. Let me see." And she bent down, and she freaking touched her toes.
You threw $1 on the floor and she bent over.
No. Only Jewish people stop and bend down for money. Oh my God, I'm never beginning to go to temple again. Now, the thing I'm saying to you is, I saw her, she couldn't even bend this way. She touched her toes. And I'm saying, and I'm looking, and I said
How
to
long
you,
did that take to do that?
5 seconds, I think. You went in,
Well,
you
it's
put
about-
alcohol, and this,
It's
and you gave her
about
a
2
shot.
minutes on the average, but that's what you see on my real show if you see it.
And you can't leave his office until you have no pain.
That's right.
He'll put you right back in and look on the thing and say, I might have missed this one little part. Look, here's a doctor that knows if he misses something, he goes back and he does it, but he doesn't charge you for it. I sent in a lady that had 4 people I know had elbow problems. One shot. No, I think one. I think the guy from Comcast was 2 shots. Couldn't even tie his tie. Raphael.
One shot.
Was it 1 shot? Okay. Oh, the girl had 2 shots because she had something in her finger.
Yeah, that's right.
Yeah. She's lifting weights now.
When
wasn't
she's
able to.
lifting weights.
Yeah, she wasn't able to.
She went from she can't lift anything with her fingers.
What's his
to lifting
name on
weights.
the radio show? What's his name?
Raphael.
No, the radio show, not Comcast.
The radio show is Leah.
No,
the Greek.
The Greek. Oh yeah,
Didn't he run out of your place because he got shot?
the Greek is a great guy. You know,
He is. I love that guy. Absolutely
he's
love.
terrific guy, and he had all his pain in his elbow for a long time. He was holding it. Oh, my elbow. So
He was funny that day.
he'll tell you this story himself. But I took care of it on the fluoroscope, and he ran out with the same pain. Oh, you're killing me! And he ran out. The next day he
calls
comes in.
up
He
Dr.
says,
Pannozzo, and he said to me, he said, "You know, Wes, it seems like I can make a deal with the guy and give him a bottle of Tito's every week."
And he fixed it.
Well, I was
yeah.
like,
The next day he didn't have the pain at all.
one of the guys was complaining about something. I'm not going to mention the guy's name, and he said that he doesn't even sponsor right now. And he said, "Oh, go see my friend Dr. Pannozzo." He gave out the number on the air because he believes that he wants. If someone's hurting, he wants to tell him.
Yeah, you know who talks about me sometime is Joyce Kaufman also.
That's amazing, and she
So,
wouldn't take. And
listen
she
to
wouldn't
Joyce.
take.
She's got a nice program there, but
Yeah, well, we used to at least 2 or 3 people that listen to a show. That's good. We'll get those. I'm going to do some questions, Doc, and I'm going to start with our new people in Boston, Mass. Okay. Scott from Boston, Mass. writes to you, Dr. Pannozzo. I saw for the first time your show on Boston Cable and wanted to know more about what you do. The website says coming soon you have an app so that I can catch up on all your shows. I've had surgery for a bad hip 4 weeks ago. They are putting me through physical therapy, but would like more information on hip surgery before I go under the knife again. Could you give me your app and address, please, Freddy? You're good with the app because I don't remember. How'd they get there?
You go to the App Store and you download Pannozzo.tv, Pannozzo.tv, and it downloads like any other app. It's free, and get it and get caught up.
And you can see everything now, Doc.
Everything.
Talk to him and convince him that he shouldn't go in for surgery, especially on the hip.
well, he already had it.
Yeah, but I mean, you might
He was
have
thinking about another
one, right?
I wouldn't do that. There was the pain. Usually, you're operating. See, first of all, you're not operating for the hip. You're operating for the pain.
right.
All right. So the pain comes from the capsule, the ligaments around it, and they're big because the hip joint is big. And if you could take care of piece by piece, you won't ever need an operation. That's what we did with the lady who was hosting here with
Oh yeah, right. You fixed something. Now she could swim.
Ingrid. Now she's doing everything.
Yeah, she was. She said she. I think she comes in
that's
now
all
just
it
to
is.
see
You
it.
have to chase the capsular pain, and then you treat it. But it takes some time to do it. But hey, nobody should lose a joint. It was not designed very easily, and it really is terrific. So try not to lose it to surgery.
And someone recommended her out by the pool. They said, if I were you, I'd go see Dr. Pannozzo. And she said, well, he said he'll get rid of that for you. And she's been going to him because she had numerous problems. She had shoulder pain, and she swims now. I mean, come on. People who like to exercise, they don't want not to be able to exercise. And now she's back, and she looks pretty good to me, right, Doc?
Right.
She makes good cookies. How's that cookie?
They're delicious.
Okay. Let me do Boston again. Bree from Boston, Massachusetts writes, Dr. Pannozzo, I went onto your website, Pannozzo.tv, and saw an interview with a senior lady who said she had scoliosis. Yes, just to let you know, she did have scoliosis. And all doctors she went through said there was nothing that they could do for her. I noticed the film work on her marvelous recovery and wanted to know how she is doing. I also wanted to know why your brand of medicine isn't used more here in Massachusetts. Is this new medicine, or have you been doing this for a number of years? That's a great question, Doc. Great question.
Yeah, well, it's a musculoskeletal medicine, and it is new, relatively speaking. It's an offshoot of physical medicine and rehabilitation. We don't use any kind of therapists at all. It's all doctor work. That's how it's so good, because the doctor does it, and he better know what he's doing, or he doesn't get the result. You have to think that way. So scoliosis is caused by scar tissue due to an injury. Now, you may not remember the injury, but that's exactly what happens. It's scarred down, ligament in there, and the bone will not move until you relieve it, and which is how we do it. We relieve that scar tissue, and it goes straight.
So basically what you're saying, no one's born with scoliosis.
You cannot be born
Okay.
with scoliosis. No.
And it's not like a rubber band, like, Dr. Pannozzo hits you with a shot and boing.
No.
I had a doctor that says, well, what, the spine a rubber band? No, it's not a rubber band.
No.
It took time to get it in place.
Also, a
for
lot
it
of
to come
shots.
out. It's not.
Well, it depends on how bad it is.
Yeah.
I mean, the worst part is between the shoulder blades. And we have a couple of people we call the humpers.
Gee,
They
Doc,
have
that's
nice, Doc. Nice.
Now, what
Humpers
makes it
means something else, Doc, just to let you know.
What makes it complicated is that there's ribs attached to the bones, so it's a complicated system there, and then there's a lung there on top of that. So you have to know what you're doing there, but it works. These people will maybe I'll have them interviewed for the.
Yeah, the lady from England. I mean, when Freddie and I first, when she told me the whole story, and this was not a youngster, so I don't know if that was one.
But we should bring her on.
Oh, would I have to bring her on? My God, she said. I mean, when she's down here, she would definitely come on. I mean, this lady, wow.
That was amazing.
And we have pictures of her, so I don't know which one you've seen on scoliosis.
Her amazing story is she worked at the big hospital in
England,
London.
yeah.
She was a nurse there, right?
She was a social worker.
Oh, social.
there,
I thought she was a nurse.
and no one would do anything for her.
They refused
They
to
didn't
help.
know how. So she spent a month here, and we took probably 2/3 of it out.
Yeah.
And then you saw her, and you couldn't believe it was the same one.
I know the same way because the only thing when you're really feeling bad and you have scoliosis, and I really feel bad for those people. You don't want to get
No
dressed.
makeup, no hair done.
And we walked in, Freddie and I, and she looked at us. She said,
You don't say hi.
"What's the matter? You don't say hello to me?" We didn't know who it was.
I didn't know who she was, Doc.
I mean, she had
The
beautiful.
main thing was her husband didn't have to put her bra.
Right.
bra on.
He gave me the bra. He says, I have a
That's
gift for
amazing,
you. I
wasn't
said, that's okay. You can keep that.
Sometimes you feel so sad, but happy when you see what you've done for these people, and even kids.
A guy called me the other day about his 15-year-old daughter, and I tried to talk him into at least getting her examined. It hasn't happened yet. You can't let a 15-year-old run their program. They just don't know enough. And that happens all the time.
Right.
I mean, you see a 15-year-old, they don't want anything to do. They want to go out with their friends. You got to stop that stuff. You got to get well. Remember, you're 15 now. You're going to be 40 one of these days. Now what do you got?
Faster
you
than
got
you
a
think.
worse situation than you have now. So you got to get it fixed, and there's nothing to it. There's no downside to it. No operations, nothing like that.
All I could say is a 15-year-old child that has to live for the rest of her life with a cage is a shanda in Jewish. It's terrible.
I
It's
would
terrible.
not allow my own three kids of 15 to tell me what to do for their health.
Now,
They
you've
will-
taken care of your children. You've taken care of your son. Your son comes down here to take care of you. So here's what I say. If you're helping your grandchildren to play a sport by giving them shots, my God, you've got to believe what he's saying. Wait, I just want to get to some more questions if you don't mind.
Go ahead,
Okay.
go ahead.
Let me get our New York people. Penny from New York City writes, I finally saw your show on Manhattan Cable and have to ask, why do so many doctors who treat ACL or Tommy John surgeries do not consult with someone like you? I was told that if the surgeries are not performed, the area operated on it will not function properly. Is that true?
No.
That's not true. Okay.
And that's an interesting question because they don't even consult with you.
No, that's the thing that I'll never understand.
I never understand that.
What's the big deal?
Well, of course you do.
Well, I understand it, but I don't understand it because if they want to do the surgery that bad, and they send you to physical therapy, which does nothing
No,
to help
God.
that situation.
I've been through physical therapy before I knew him.
So then why wouldn't you consult? And look at
Because
this
they
different?
because it's that's what they do.
Because they consult and he fixes it,
They are
goes
so
to
sure
patient.
of what they're talking about that they don't want anybody to know about it. As a matter of fact, you have a story about someone who's wanted to come down and see me, and they rushed him into surgery the next
yeah.
day. Remember
Harvey.
that? Well, this happens all the time. If you give these surgeons any doubt at all, they'll drag you in there quick.
So
I mean,
this is up to the patient, the person that
That's
has
what
to
we-
make the move.
It's what we just described. On your health, you better know what you're doing because it's your health.
That's right.
You got to research. You got to find out is there another alternative with surgery? Because I know people that have had surgery. They're not the same. He knows one of them.
Well, first of all, you can't even find a surgeon after that. They don't have anything to offer you. Remember, once it's operated, they don't have a job anymore. You understand? So now, what do they do with you?
They send you to another surgeon.
They
who might
won't answer the phone, then
No.
they send you to therapy. I mean, that's wrong. It's wrong. Absolutely wrong.
When I went for physical therapy before I knew him, the guy said to me, "Get on a bike." I said, "I do that at the gym." He said, "Okay, well, do the treadmill." I said, "I do that at the gym." He said, "Lie down." I said, "Okay." moved my leg. I went to the doctor. I said, I feel worse now than I felt before. Before my ankle hurt me, now every part of my leg hurts me. What the heck did he do? He said, well, let me give you some medicine. I said, okay. I called up my other doctor. I said, can I take this? He says, no, don't even touch the bottle. Rip up the prescription and throw it in his face. How come he didn't ask you what medicines you're on? He said, don't yell at me, doc. He said, get out of there now.
Let me tell you,
Seriously, that really did happen.
the insurance companies like you to refer to therapy. Why?
Yeah, why?
I don't know why, because it's expensive and you don't get anything from it. If you look at the programs, first of all, they don't take orders. You know, when I was in training, you used to write orders for the therapy because we created the therapists. Our specialty created them. And then all of a sudden, they're on their own. They have an office here and they don't take orders. You have to refer the patient to them and let them do whatever they want with them. Well, that's not good medicine. You know, if you're the doctor, you better know what you're letting happen to your patient.
Right.
Are you responsible for your patient or not? I would not have a therapist in my office because it's all doctor work. But the general practitioners and the orthopedic surgeons refer everybody to the therapist, and they don't know even what they're doing to them. Now, for instance, if you have a diagnosis, say you have your real diagnosis that I do, and you find out what kind of program they were on, you find it has nothing to do with the diagnosis.
Right.
It has to do with exercise. See? Exercise, treadmill, knees, whatever they do, but nothing to do with the diagnosis because they don't know how to handle the diagnosis.
They don't know where the pain came from.
And they won't take any lead. In other words, they don't take orders.
And they're looking in the wrong places.
And they look in the wrong place. So that's not a good thing. So when I show the insurance companies, I said they don't have a program for this. They say, "Oh, what do you mean?" I said, check and see what they're doing with this diagnosis. They don't have it. They don't know what to do. And they're not trained that way.
So people from Pittsburgh, I just want to say one thing. If anybody in Pittsburgh, if anyone in Boston calls up, you will get directly to Dr. Pannozzo. He will ask you on the phone just an idea, how did this happen, why it happened. And then when you come into the office, he's the only one you see. Except there's some blonde guy that walks around every Tuesday and Thursday, but he's not the doctor.
Why don't you give out the number? Maybe they want to talk to him.
Okay. If you want to call up now, it's 1-800 889-0267. So if you happen to be listening to the show, watching the show, you went on your app, it's 800-889-0267. Dr. Pannozzo will be more than happy to talk to you about anything. He's a nice guy. He'll listen to any problems you have.
The office number is
561-381-5800.
That's it.
Do you have to look there to see? You know, it's funny. I don't know my own phone number at home. Do you?
It's at home, no.
No, at home, I don't know my number. They said, what's your home number? I said, 85. Okay, we'll get some more. I want to get some more stuff in here. I did that, Boston. New York City, Harvey. Harvey from New York City writes, I went to visit a stem cell doctor here in the city to help with a bad knee. They termed it bone on bone, and what he explained was that stem cell treatment will help cure you faster. But will it remove the pain in the knee? My question is, by removing the pain in the knee, does that knee get better? Is the knee stable enough to go running again? With stem cell?
Stem cells are not necessary. It's expensive and overblown. You can't have a stem cell differentiate into different tissues outside the womb. This happens before you're born. That's how you get a liver, a kidney, a lung, a brain. That stem cell differentiates in all those. But once it's done, something tells those cells to stop doing that. So they don't differentiate anymore. So now they're taking these stem cells that are running around and they're trying to say, I'm going to put it in a knee and it's become a knee. It's not going to become a knee at all. It's just a waste of time and money. And all they have to do is take care of the scar tissue there and quit replacing the knees, because bone on bone is only about 3 inches of the circumference of the knee. And they're replacing the whole thing for that. So if it was me, I would not do that. And I'm telling you, good advice, free, don't do it. It's not worth it.
Well, also, when you do stem cell, I don't know that. Does it create scar tissue?
Doesn't do anything.
Oh, okay.
It's bathing the area.
Okay.
with stem cells, which are used to formulate organs in the body. And what Doc is saying is,
Where they get the stem cells from your body?
Yeah.
yeah,
Yeah,
They take
there's
it out
stem
of your
cells running around. They could
Right.
get those. But it's a laboratory procedure. They have to take your blood and they do something with it. And then they get the stem cells and they inject it in there. Now,
that's-
it's supposed to differentiate into ligament
Right.
or cartilage. It can't do that. It doesn't do that.
and it's not going to alleviate the pain in the
And
area.
it's
either.
almost $30,000.
That's
yeah,
expensive.
and it doesn't alleviate anything.
It doesn't alleviate the pain.
No, these orthopedists got to stop doing that stuff.
So, Doc, let me ask you a question. So, $30,000, not guaranteed, not covered by insurance. You could cure that in about how long? A day?
Oh, about a day or two.
Day or two, and you don't charge $30,000, do you? No. Anywhere near it?
No.
Okay. Folks, what are you waiting for? Now, people, here's what I've discovered from talking to people that I've gone to. Our friend, Jim, operated by one of the top physicians for knee surgery in the world, according to him. And I checked the guys there. They're good, they're knee surgeons. But now he's coming to you because of all the scar tissue that developed on the both knees.
Yeah.
And he's in pain.
Well, he was in pain, but know what I saw him doing yesterday? He was on the bike. He hasn't been on a bike since he met you. Since before he met you, he was on the bike. I've never seen him do cardio. That was the first time I actually saw him on the bike, which puts a lot of pressure on your knees. So
Yeah, he's doing really
well, he
good
had
now.
a lot of. I mean, he had
A lot of scar
so
tissue
much
left from the surgeon, and the surgeon didn't do anything for him.
And you
And
can't
does that scar tissue return, Doc?
no,
once you take care of it?
once we take care of it, it does not come back. No.
I mean, that's unbelievable. I mean, when you look at it, how you discovered how to do this is like mind blowing.
Yeah, we use steroids a lot, but and I evaluated probably must have been 30 of them or 34 of them, and I looked at each and every one of them, and I picked the one we use because it's clear, short acting,
Right.
does a highly effective job, and you don't need the rest.
And it's the one that's
The powder
approved
form
by the NFL.
the powder form should not be used at all.
Yeah, we looked up the anti-doping.
Yeah.
The medicine is
Yeah.
there, and it says that the way the doc is using it,
Yeah.
it's legal.
Yeah,
Because it has nothing to do with performance. It
That's
just gets rid of the
no,
pain.
and it's out of the body in 9 hours, so you can't beat it. I mean, it's terrific, but
Well-
you have to know where to put it, why and where we put it. It's not the substance. Everybody wants to know what's this miracle drug. It isn't.
It's not a miracle drug. Anyone can buy it. It's where you put it.
It's
How you
why
use
and
it.
where you use it.
Yeah.
Okay, let's get to our friends in Atlanta. Jay from Atlanta writes, Dr. Pannozzo, me and my churchgoers listen to your program every day at 9 a.m. and want to know if you are going to be in Atlanta in the future. I have migraines all the time and have listened to how you can fix a problem permanently. Now I have a new problem. It's called lower back pain. My lower back on the right side hurts all the time. My doctor says I have arthritis and I should take painkillers to help me heal back to health. I want to know if I came to see you, can you work on both areas at the same time, or do I have to take 2 trips?
No, we would. Anybody that comes from out of town, we see them twice a day, and then get everything fixed up. Right.
Now, if you drive to Atlanta, it's only 600 miles to where Doc lives. If you fly, it's 90 minutes. And let me tell you, you can come in the morning, fly in the morning. Doc will see you right away because you came from out of town. He'll tell you to go over, have some lunch, come back at 3 o'clock. Come back at 3 o'clock. You could be on the airline in Palm Beach, about 10 minutes from his office?
About 15 minutes.
About 15 minutes. You could be home in Atlanta and having dinner. So it's well worth it.
No, it's well worth the trip because, especially for migraines, no one does this work. I'm doing the work. I did the research on it.
And folks, my wife had migraines ever since I met her. I don't know if she got it before I met her or after I met her. Okay. And she never ate any of those trigger foods. Never ate liver. Never sat out in the sun. Never did any of the things. And it proves one thing. It has nothing to do with what you eat.
Right.
You could eat liver, sit out in the sun.
She suffers from migraine?
No more. She was put on Inderal for her heart. And Inderal opened up the neck things for the heart, I guess, and it doesn't.
No.
Hasn't had a migraine since.
It's just a ligament structure that
Right.
Cured itself.
Yeah, but amazing what you say. I mean, it's real. I mean, it doesn't. I'm living proof to know that it works. You know why? I brought 3 people in with migraines, and the only thing bad, Doc, is that we're going to kill your business because they never come back.
They don't come back.
And
No, they don't, and that's okay.
Nothing. Look, he was busy. He had 50 new patients when I came
We
to
got
see him Tuesday.
480 million people in this country who have pain, so
Yeah.
I think we'll be busy for a while.
And here's what I say to everybody: the only thing, he'll cure you, or he'll stay there until he cures you. And guess what? No surgery, no medicines, no drugs.
Now, there are a lot of physical medicine specialists around, but
They relieve pain.
They don't really do this kind of work. I mean,
They don't?
No, they have therapists around, and it's not the way to go.
Here's what I tell
You've
everybody:
got to get rid of the pain as a doctor treatment, and you can do it if you know how, and I'll teach you if you like.
don't go to pain relief centers. You ever see the signage right by pain relief centers?
Yeah.
You don't want to be relieved. You want to be cured.
Yeah, you got Dr. Pannozzo's brand new medicine bottle.
Oh yeah, I want to show this to everybody.
And what's in it is his address and phone number and his app.
This is
There's
a
no
medicine
pills in
bottle
there.
that you could use anytime you want, because you know why? Can't hurt you.
What do you do? You rub it on you?
No, you just
No,
take it on.
no pills.
It's got an app in here, how to find you, and now
The
you've
address
got your app and address here.
and phone number.
And folks, if you go to Dr. Pannozzo's app, it'll download and show you how to get to his office, everything you want to know, and you can see. You want to see about scoliosis? Go down to scoliosis, you can see about scoliosis. You want to find out about migraines? Go down and see the people he's taking care of with migraines. There's nothing else we could do. I mean, that's it.
And there's a questionnaire box on the app if you want to write in and ask a question. Let us know what you think. Something we've never heard of.
Right.
We're more than welcome.
And
Look, if you don't try it, you can't get the benefit.
right.
That's right.
So don't believe anything you've heard. This is all new stuff. And I mean, if you ask your family doctor, can I get rid of migraine? They'll say, never heard of such a thing.
Right.
And they'd be right. They haven't
haven't.
heard it, but you're hearing it from me now. I'm the author of this.
That's right.
And I'm responsible. For instance, you could call up right now. If you failed on anything we talked about, tell us.
Yeah,
I'd
if
like
Dr.
to hear it.
Pannozzo has failed on
What
anything,
I would do is mark your name down and go look at the record and make sure that what you're talking about is actually true. So there's a couple of ways I handle criticism. One is if I'm wrong, I'll change. And if I'm right, I'll say,
you're wrong.
what you should do.
And yes, you said that a couple. Okay.
Anyway, it's a very scientific, intellectual way
Yeah.
to do these things.
And if you're a chiropractor or an orthopedic surgeon that thinks what he's saying is wrong, by all means, you could call us up and we could have a nice conversation.
And I want to clear something up. There is no hidden photography. We don't.
Thank you.
We don't play with the film. Everything that you see on there, because I was accused
Yeah, I know you
of
told me.
doctoring the film on
Oh,
the
who did that?
scoliosis.
That's not true.
doctor.
Yeah, he was telling me this.
And it really got me ticked off. And I said, listen, I'm not smart enough to be able to do that.
And number two, we don't want to go to jail, and we don't want to spend time because
I don't need to do that.
see, you could
Well,
go to
you
jail
gotta-
if you're a tough guy.
Well, you got to remember that I'm very successful in my past. I mean, I've been at this 54 years, for crying out loud.
We wouldn't even know how to
And
doctor that.
I don't need to do anything except give you the real scoop because I'm a real student of medicine. I'm not, I'm very scientific in my approach. And if it doesn't work, we wouldn't do it.
And if anyone thinks we doctor it, you let us know. We'll bring the patient in,
That's right.
and you talk to the patient.
Yeah.
That's even better.
And all these patients, they love to tell people how good they are, and they want to say it on film, on the camera.
Well, Ingrid said someone talked about you so much when she was that she said I had to come here, and she said the best thing she's ever done.
Yeah.
The lady that had 96 million shots of Botox everywhere said, "I'm done. I'm done.
Botox,
I found the guy."
don't do Botox. Don't do it. I don't care if these doctors are mad at me. That's okay. Don't do it.
You're
It's
trying to
the
save-
best- Well, we're trying to do the best we can for the public. That's what counts.
Could you imagine spending X amount of dollars every 4 months for a Botox shot?
That's crazy. It's crazy.
Well, it's crazy.
Okay, so I'm gonna. Let's see. Time? I got some time for more things. Okay, Maddie from Atlanta writes. I remember about a year ago you wrote that a pregnant woman can come see you when they have pain in the lower back from carrying the baby.
I did.
Is that yes? And now a year later, I am pregnant with my child. In 6 months, my lower back is killing me. Can I visit you and not hurt the baby, remove the pain in my lower back. Well,
She wants to make sure that what she heard a year ago is correct.
yeah, well, he said pregnant
Yeah,
people
but
coming
she's
in to
only
see
been
him.
pregnant 6 months. She should have come in between pregnancies.
Well,
don't you think?
she was probably in pain now, Doc.
You know what it is, Doc?
So yeah, no, nothing will happen to the baby. Just come in.
Okay, we got Magda from Boynton Beach who writes, my mother went to see you for migraines about 6 months ago, and they have not returned. Wow, it's great. Thank you. I must admit that I thought she was crazy when she told me she went to see you. But now she has the last laugh because I, too, have migraines and want to see you. Being that I saw the first show last week, can you explain how migraines in your program are wiped out, never return? Why don't you ask your mom?
Her mom is probably confused why she doesn't have them.
Boynton Beach, right around the corner.
Oh, right around the corner. Well, there's a source of a headache. Headache is a symptom. Migraine is a symptom, not a source. So we know where the source is. We treat it directly, and that takes care of it.
Is everybody's migraine the same, Doc? Would you treat mine and less having migraine? Would it be treated the same way?
All the same. Yeah,
Always the same.
always the same.
And vertigo as well?
Yes.
How about tinnitus? Talk
Yes,
about that.
same thing.
The ringing in the ear.
Yeah.
Yeah, but the
Wow.
funny thing is that all those are clustered in the same area,
Mm-hmm.
and he treats us the same, so it's a common thing among humans, I guess.
It is. It's the way we're constructed. And those people with concussions are usually have the pre-migraine source of pain.
And
So it's the
finding
same
out
place.
that it's the shoulders.
Because nothing happens to the brain. I was just watching a documentary last night, and I don't know who these people are, but they were talking about the brain changes and all. That's so much baloney. That's just not true.
Well, they had concussions. The NFL started preseason on Thursday, the games, and they had concussions, and they're changing the protocol. Some of the players are already back at practice because they found out it's not in the head.
Right.
Eureka. It's in the
Eureka.
neck.
I mean,
Oh, where they been, Doc? Where they been?
I mean, you were a coach of a professional football team. How many times when they hit that head went back?
It snaps like a car accident.
It's got to be.
Yeah, but don't say that because you get movies like Concussion, you get all sorts of doctors, and everybody is putting in the 2 cents, and they're all looking in the wrong area. That's the one thing I have to admit about you,
They're
Doc.
all protecting their background.
That's right.
And they don't have enough background to diagnose these things.
No, to that old saying, Doc. The
So
proof for.
now
Go ahead,
I can't be everywhere,
No.
and a lot of them don't even want me around because I'm anti what they say. That's the way it is.
But you have proof.
And I don't care because we get
Yeah,
we're
But
very
you
successful.
have proof to show that this works.
But
That's
they end
true.
up going where you pointed them
Right,
to.
right.
Like that hamstring injury that
Yeah.
the Jets are holding on to this kid.
Oh man!
They come see you. You probably have him on the field in less than a week.
Be on the next day.
The next day,
I'll give the physical therapist a couple of days so they can feel good. I don't care. I just want them on the field.
I wouldn't give him anything.
But the thing is, from watching all the time, when you go for physical therapy, they're gonna hurt it more by twisting it. I mean,
yeah.
That's what happened with Lou.
yeah,
He got
right.
you cure Lou. He went to the
Chiropractor.
chiropractor because he was a friend of his.
Came back to
and now
see
he
you.
was crying. He couldn't move. I said, you got to go back and see Doc.
Look, I'm not going to say anything about chiropractors. What I'm trying to understand is,
Really
folks.
don't treat these things. I mean,
Well, no, it's not only that, Doc. I'm going to stop you for that second. If you don't know where the source of that pain came from, you can't fix it. I know chiropractors that come to see you.
Yes, that's true.
I mean, come on, guys.
Got any questions?
Oh, yeah, sure, Doc. Got
One
plenty.
more.
Okay. Jack from Miami Beach writes, I caught one of your co-hosts on the show say that your son or daughter plays sports. They should come to see you to find out if there are any ailments to watch for. Can you give me a better explanation? As a coach, a high school football team in Miami, and will be listening to your show sometime today within the rules to give me an advantage with my athletes. In other words, basically what he's saying is how you could, that was you were the co-host who's talking about, how if they came in to see you, if you could diagnose them to find out if there's any problems.
How it improves his chances to win.
Yeah, how it's,
The general principle I use is you examine someone for sources of pain before they play, not after they get hurt. I mean, you could do it after they get hurt, but do it before. So anybody that his star players should be examined for any deficiencies, I call it, or pain. Then we could treat that. Then they'd go out in that field.
Would you use
do a heck of a job?
Would you use a C-arm to check
No,
everything?
no. It's a clinical examination. There's nothing to it. You have to know.
He's going to check first.
Okay, we got Rich from Royal Palm. That's gonna be the guy. Hey, Rich, how you doing? Hey, Rich, how you doing? Hello, Rich.
Rich,
Rich,
call back, Rich. It looks like your phone died. Is he gone?
is he gone?
He's there?
I'm pressing the
I
button.
don't hear him.
Hey.
There you go.
I'm here.
Hey, Rich.
Hey, how you doing? Dr. Pannozzo, how you doing? Listen, I'm the tennis player, and I've been to see you twice with the pain in the right side. And the last time I saw you, I had 1 day of relief, and then it was right back to what it was, and I'm still suffering from this. And I just want to get your take on this. I talked to Manx, and he says I should absolutely come back and see you again. And I'm a little up in the air. Like I told you, I got a son that's a occupational therapist, a daughter-in-law that's a physical therapist, and they're very skeptical. And all I want is relief. And I know I've talked to you a couple times about it.
Listen, just bring them with you. Now, low back is, as I recall, you had a scoliosis too, didn't you? We straightened up your back.
Well, I don't know what you. I don't think that was. I don't think that was the case. You never said that to me. I mean, you said my pelvis is a little off kilter or something like that. And you pointed out the L4 and the L5.
That's what I'm talking about. That's what I'm talking about. So every part of your back has to move to accommodate. And you're not a young kid either. How old are you?
I'm 63.
63. So, you're pretty stiff. But the principle here is you chase the pain, and the pain will be different every time you come in. Because once those pains are treated, they don't come back. And your relatives ought to keep their mouths shut because they're not responsible for you. I'm responsible for you. And if they want to learn more, they can come with you, and I'll teach them. But should not criticize the treatment to you because you have no way to respond to it. So that's for everybody. I'm not picking on you. I'm telling everybody. Do not take anybody's word for it that what I can do or not do.
That's right.
You ask me, and I'll tell you what it
finish chasing.
Yeah, so you come in this week sometime, and we'll chase it down for you and let you know what it is.
Okay, but
Right.
I mean, how many times do you think I need to see you? I mean,
It just
till it's
depends on
gone,
what
or-
you're talking about. I don't know what you're talking about. I have to hear you again.
See the records?
And look at the record and find out what we're doing. I have no way of knowing.
When Dr. Pannozzo worked on the lady from England with scoliosis, she was in for treatment for 4 months. No?
Yeah.
Well, 1 month.
1 month, but she kept coming back because you needed to chase
She was there
I
twice
need
a
to
day.
chase the different things.
Twice a day,
Yeah, and your situation is a little bit complicated, but he will get to it and come on in, and let him continue to chase the pain, and we guarantee you're going to be on
Now,
the show telling us it's good.
When I kind of remember him because he was really a little skeptical no matter what I said because of what his relatives have been telling him. And these are nobodies. They're not trained in diagnosis and treatment. Occupational therapist doesn't know anything about this. Physical therapist doesn't really treat this, right? They do stretching.
They stretch. It's a stretching thing.
You got to realize what you're dealing with there.
Yeah, and I tell you, Doc, I do. And I'm very open-minded, and that's why I came to you.
Yeah.
Well,
Okay.
then you just come back. You just come back until I tell you I'm done with you and I have nothing to offer you.
You come on back, he'll chase that pain, and
He'll
we
find that
guarantee
pain.
you. We guarantee you he'll find it. Absolutely.
Okay, all right.
Hey, Rich, thank you so much for calling. And remember,
thanks for
you're
the
going
call.
to the best when it comes to musculoskeletal stuff. I mean, I don't.
Well, I'm glad that Rich called him.
Yeah.
Because, we want people to be on both
Honest,
sides.
tell the truth.
No, that's okay. A
And
lot
there's
of
nothing
people
wrong with that. And you know what? You're true, Doc. Let him bring his family.
I had a lady who complained about my treatment. She came in the office with a hip pain, and somebody told her she had avascular necrosis. Well, that, how would you get that? I mean, you can't.
I can't even pronounce that.
You can't. I mean, you can't
She
get
came
it.
with a Vasco Pannozzo.
It's a bone dying in the hip. Now, when I examined her, she did not have that. She had a tendon, which I injected. She walked out pain-free. Next day, she goes and gets operated and blames me for a bad diagnosis.
She went and got operated?
Yeah,
After she was
she didn't
pain-free.
give me a chance to fix this out for her. So, that's not my fault.
No.
If you listen to other people and don't tell me about it, that's your problem, not mine.
They got to finish
Yeah,
the,
you gotta finish.
the session. And I know people who didn't finish the session and complain. I said, you got to finish what he started out doing. All right, we're done, buddy.
Hey, again, folks.
Thanks for calling. Those of you didn't call, you should have.
And if you want to call Dr. Pannozzo, I'm driving today. You call him anytime you want. It's 561-381-5800.
Yeah.
It behooves you to get a second opinion before you go under the knife.
Yes, be careful who you listen to.
And you know what? There are sometimes he has to chase the pain. I mean, Rome wasn't built in a day, but it was destroyed in one day.
That's right. All right.
Thank you so much again to get a hold of Dr. Pannozzo. It's 561-381-5800. Hope we taught you something. Hope you had a great day. God bless our troops and everybody. Have a great Sunday.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
Stream this report live on our iHeartRadio app.
A little more activity.